Hi everyone. Today lecture covers the major respiratory viruses that causes upper respiratory and the lower respiratory tract infection. We will explore the etiology, pathogenesis, laboratory diagnosis, clinical management, prevention, and the existing new molecular technique which used for diagnosis of these different viruses. Our focus will be on the three of the most significant viral pathogens responsible for the respiratory illness, including you can see in the picture SARS-CoV-2, respiratory essential viruses, and adenovirus and the other virus. Let's start with the learning outcome from this lecture. By the end of this session, you should be able to classify these viruses according to the last international committee taxonomy virus, understanding their structure, genome, organization, replication strategy, and explain how they cause the disease and interact with the host immune system. Also identify the most laboratory diagnostic method which used for the diagnosis. Also we will compare conventional and molecular diagnostic techniques which used for the diagnosis of different viruses. Finally, we review current antiviral therapies and vaccine which used for these viruses. Let's ask questions. Why are respiratory viruses important? Respiratory virus is important because among the most common infectious agents worldwide cause infection. Every year they are responsible for millions of outpatient visits and hospital admission. This particularly خاصة among infants or older adult and pregnant women. Immunocompromised also among the immunocompromised patients. Besides causing a seasonal epidemic such as the influenza, which cause epidemic every year seasonal, they also have pandemic potential such as the COVID-19. The economic impact is very large. Why? Because of hospital admission and people missing a work put heavy pressure on the healthcare system and the economic. For a public, these viruses are particularly challenging to control. Why? Because they easily transmitted or rapidly transmitting. Also, the virus is keeping mutating for a long time and need ongoing laboratory monitoring to catch a new variants and update it of the vaccine. In this picture, this slide compare. You can see a different map of the H1N1 influenza pandemic and COVID-19 pandemic. Here the slide compare global spread of the two viruses which cause respiratory tract infection. H1N1 is spread rapidly worldwide, but the COVID-19 spread for more cases and affect nearly every country when pandemic occur. This pandemic demonstrated how quickly respiratory virus can spread through global travel. إشارة سريعة كانت تجي للglobal travel and highlight the importance of surveillance to detect disease virus. Important surveillance and indicate importance rapid diagnostic technique, introduce diagnostic technique like COVID-19 change the flow work in all the laboratory and PCR become routine technique. Also highlight the importance of vaccination and public health awareness. To understanding how this virus is spread is a fundamental to the infection control. فهمنا ليه transmission procedure of this virus هو البيز الأساسي to control the infection. The major route of transmission or routes for the transmission of this respiratory virus included droplet transmission. These are the large droplet here, the large particle aerosol greater than 5 micrometers generated by coughing, sneezing, or talking. They travel short distance, typically less than 1 meter, and are the primary mode of transmission of many respiratory viruses. The airborne transmission way also is the most important way for transmission of these viruses. Airborne transmission here is smaller particles less than 5 micrometers that can remain suspended in the air for extended period for long period and travel long distance like measles, tuberculosis, SARS COVID-19 too. finally بنلقى انه واحدة من الطرق اللي بيحصل بها transmission اللي هي عن طريق الكونتاكت direct contact transmission. Direct contact transmission occur either directly through person to person physically contact like a handshaking or indirectly contact through surface اللي هي contaminated surface like a doorknob and the phones. The virus is then transmitted. After that, the virus transmitted reaches to mucous membrane of the nose, mouth, eyes. This multiple way of transmission makes respiratory virus particularly difficult to control. In this table, we highlight the major respiratory virus encountered in the clinical laboratories, which cause a respiratory tract infection. From the diagnostic, protective, understanding viral classification. الستاندرد classification مهم لنا جدا، هيساعدنا predict the genome type والstability والreplication mechanism and the most suitable molecular assay which used for the diagnosis. And involved viruses are generally more sensitive to a disinfectant, whereas the non-involved viruses such as the adenovirus and the rhinovirus survive longer on the environment surface. You can see that is there different type of the virus: influenza A and B type, respiratory syncytial virus, human metapneumoviruses, parainfluenza, SARS-CoV-2, وseasonal coronavirus, والrhinovirus, والenterovirus D68, والadenovirus. All these viruses causes respiratory infection. Belong to the different family اللي هي إذا جينا للإنفلونزا فيروس belong to the الأورثومايكسوفيريديا والريسبيراتوري سينشيال فيروس والميتانيوموفيروسز belong to the what to pneumoviridea. أما البارا إنفلونزا belong to the paramyxoviridea. السارس كوف 2 and the seasonal coronavirus belong to coronaviridea, while rhinoviruses belong to the biocoronaviridea, while entero also belong to biocoronaviridea. Adenovirus belong to what to adenovidia. The genome sequences is different. The genome type is different. There are RNA, all of them are RNA, especially except adenovirus. It is a double-strand DNA virus. All of them have involved except adeno and entero and adenovirus have not involved, which make them more resistant to this infection. Here in this slide, I compare different structure between the influenza viruses and the SARS-CoV-2. Both of them are involved RNA virus, but influenza has segmented of negative sense RNA genome with the 8 segment, while a SARS-CoV-2 have a single positive sense RNA. Influenza has a 2 protein, service protein, اللي هي called the hemagglutinin neuraminidase, help to infect the cell by binding silical acid receptor, whereas the SARS-CoV use spike protein to bind to ACE2 receptors اللي هي الانتيجلوستين converting enzyme to a service glycoprotein specifically determine viral attachment and the cell terrorism. نلقى أي سيرفيس بروتين موجود في الانفولف حق الفيروس هو اللي بيحدد لنا السيل terrorism. Cell terrorism means the cells which cells the virus can be infected, which directly affect the disease symptoms or a disease manifestation. From the previous slide, you can see here the different structure protein of common structure components of the old virus: the viral genome, الكابسيد, الانفولف, والglycoprotein spike, والmatrix protein, والviral polymerase reaction. This important component of the structure of the virus, it is help in the laboratory diagnosis. The surface protein are a target for the antigen detection because they enhance the immune system. Viral RNA or DNA, it is a target by PCR assay. While structure protein, it is important for the vaccine antigens, while surface glycoprotein determine the viral attachment and the cell terrorism. That means all the structure component, the common structure component of all the virus is important for laboratory diagnosis. The pathogenicity of the different viruses. The pathogenicity of respiratory viral infection occur in a series of steps. Generally, all begin by the transmitted of the infectious droplet or aerosol, followed by the attachment to the receptor on the respiratory epithelial cell. After that, the virus enters a cell through membrane fusion or receptor-mediated endocytosis. After that, uncoating it is occur and the viral genome is released and replication begins with the genome replication and protein synthesis. New viral assembly and are released to infected near other cells. The virus is breathed locally within the respiratory tract, and the host's inflammatory response contributed to the injury. Understanding of these steps help us to identify a target for the antiviral therapy and prevention strategy for the control of this disease. With the viral attachment site, the attachment step is important step or need to be is important step. Because why? Because it determines infections. معرفة نوع الاتاشمنت أو السيلولار ريسبتور مهم جدا لأنها هي بتحدد لنا الانفكشن. السبيسيفيك ريسبتور used by the virus to determine it is tissue terrorism اللي هي which cell and tissue are susceptible for the infection. This explains the disease severity, receptor حاليا severity of the disease, and host specificity and the transmission efficiency. For example, influenza viruses bind to salicylic acid receptor which are abundant in the upper respiratory tract, while a SARS-CoV-2 uses an ACE receptor which is found on the type 2 pneumocytes in the lower respiratory tract as well as the other tissue. That means influenza virus infected the upper respiratory and the SARS-CoV infected the lower respiratory tract. Understanding the receptor interaction has been important for developing antiviral therapies and understanding why a certain population are more susceptible to the severe disease. Here we talk about the host immune response to the respiratory virus. When a virus starts a pathogenesis and starts a replication in the body, there is two types of the immune developed. First type of the immune is innate immunity, and the second type is adaptive immunity. The host immune response begins with the physicals. By the innate immunity, begin with the physicals and the chemicals barrier, mucociliary clearance mechanism removal inhaled pathogen, while mucus trap serves and contain antimicrobial peptides. Next, the complement system provides organization and lysis of involved viruses when cellular defense include macrophage and neutrophil and the neutrophils اللي هي it is kill the virus by phagocytosis process and produces cytokine. When natural killer cells destroy the infected cells with reduced MHC1 expression. الكلينيكال significant بنلقى انه برضو type 1 interferon alpha وبيتا induce an antiviral disease inhibit viral replication. الكلينيكال significant due to this response of the immunity of the innate immunity response اللي هي lead to the mild or asymptomatic infection, while excessive activation of this immune response can cause a cytokine trauma or acute respiratory distress syndrome. اللي هي impaired innate immunity increase the risk of the severe. Once إنه حصل impair في الاميونيزم أو fail innate immune system to clearance of the disease, that means increase the risk of the severe disease. In the adaptive, another type of the immunity is activation or adaptive immunity. The main purpose of the adaptive immunity to eliminate the virus infected cell, produce virus-specific antibody, and establish long-term immunological memory. Adaptive immunity develops after several days after infection and provide highly specific antiviral protection. CD8 T cell eliminated the infected cell, while B cell produced neutralizing antibody. Uh, laboratory serology depends on this immune response, measuring IgM or IgG antibody, which assist help in the diagnosis acute or chronic or last or latent infection or past infection. Help for that بنلقى immunological marker like IgG or IgM help in the diagnosis, epidemiological surveillance, and vaccine evaluation. A memory of a T cell or B cell provided long-lasting immunity and form the basis of successful vaccination. نلقى إنه ال IgM اللي هي marker for recent or acute infection وال IgG indicate previous infection or vaccination. More increase for more than four-fold rise in ال IgG titer اللي هي confirm recent infection using البيرسيرا وال CTL mediated inflammation to contribute to tissue damage بيحصل لنا ب reaction between the immune system and adaptive immune system و الvaccine induce neutralizing antibody and the immune memory which can detect it or measure it in the lab. How these viruses can escape from an immune system, an immune invasion by respiratory. That a respiratory virus have evolved different mechanism to evade the host immune response by what? By suppression of type 1 interferon alpha or beta response, also inhibit the antigen presentation 1, also by the antigenic variation and mutation of a virus surface protein, also continue changing a surface protein, also by glycan shielding اللي هي mask glycan shielding mask اللي هي covering the viral epitopes from the antibody binding with cell-to-cell spread, avoid the antibody neutralization, also by latency enable long-term persistence of the virus inside the cell اللي هي example لها من الادينوفيروس. Examples of the viruses which use a different mechanism to evade the immune system اللي هي الانفلونزا have a mechanism antigenic drift and antigenic shift والSARS-CoV-2 اللي هي like a spike protein mutation بيحصل mutation في الspike protein الاميون escape variant والrespiratory syncytial virus inhibit the interferon signal and decrease the innate immunity or weaken the innate immunity. طيب example بنلقى انه اذا جينا للانتيجينيك دريفت والانتيجينيك الفيروس اللي هي شنو بيحصل تشينج في الجينوم وبالتالي هيطلع لنا سيروتايب مختلف خالص عن السيروتايبس الاول فبالتالي هيكون very difficult to develop a vaccine or stable vaccine for a long time. The general clinical spectrum of a respiratory viral disease في الupper respiratory tract بنلقى إنه common infection بتكون common cold ورينيتس والسينايتس والفرينتايتس والارفنجايتس. في اللور بنلقى البرونكيتس والنيمونيا والacute respiratory distress syndrome. This is a common respiratory infection. That means إنه respiratory virus can affect any part of the respiratory tract producing a different clinical syndrome. Who is a get infection or who are the high risk group for to get infection? A high risk group including a neonate, an elder, pregnant woman, an immunocompromised patient, and those with chronic lung disease, diabetes, and the cardiovascular disease. The clinical severity of the disease of different virus type or host factor and whether the infection remain in the upper or lower respiratory or progress to another system. This spectrum of the disease, it is a guide our diagnosis approach and treatment decision to treat it of this virus. يبقى high risk group هم ديل اللي قدامنا النيونيت والelder all this group. Let's start we talk with the first virus influenza virus. طيب Influenza virus is infect the respiratory tract. Influenza virus belong to the also myxoviridae family. It is an involved virus with a segment negative sense RNA genome composed of 8 segments. There are three types A, B, C. Type A and B called the seasonal epidemic, but influenza A here response for the most epidemic and pandemic influenza infection. Influenza A is a subtype, is classified by use or depend on hemagglutinin or neuraminidase service protein which found in the involved. والcommon subtype of influenza A اللي هي H1N1, H3N2, H5N1 and H7N9. Clinical syndrome of these viruses is ranging from the mild rhinitis to fatal pneumonia with systematic with prominent systematic symptoms including fever, amnesia, and general symptoms. Complication from the infection by the influenza اللي هي can lead to the secondary bacterial pneumonia, arise syndrome associated with spring use in the children, also Guillain-Barré syndrome. Pandemic potential from these viruses it depends mainly on genetic shift اللي هي rearrangement of segment genome which can create a new pandemic strains. While a genetic drift is caused seasonal strain change and the vaccine mismatch to this strain which is new for every year. That make this virus is very difficult to control. Here in this slide you can see a life cycle of the influenza A viruses. The virus starts by the entry to the host cell initiated by the hemagglutinin. بعد ذاك بيحصل لنا الريسبت بيحصل mediate receptor binding بيحصل endocytosis والmembrane fusion. After that releasing internal genetic content into the cytoplasm. After that viral RNA are transported into the nucleus. Genome transcription occur. Export messenger RNA from a nucleus to cytoplasm. Viral protein are expressed in this point, and the newly synthesized protein it is assembly in this point and the complete viron it is released from the cells by the budding, which that means it is have involved viruses. Eventually عندنا البيولوجين فيرون بيحصل له release from the host cell surface via a neuroamidinase mediated receptor destroying. بنلقى عنده different structure protein اللي هي الموجودة عندنا in the left of the slide اللي هي ال HA وال NA وال M1 وال M2 وال MB وال BB1 وال BB2 وال BA. هي the target area of the different drugs to kill which used for the treated patient infected by the influenza اللي هي ال M2 inhibitors وال neuroamidinase inhibitors وال polymerase inhibitors اللي هي different type of antiviral drug used for the treated of the influenza. For the laboratory diagnosis, the most briefed sample or suitable sample for diagnosis of influenza is a nasopharyngeal swab. It is not available. We can use the nasopharyngeal spiroid. In the chronic stage, we can use the broncho-alveolar lavage اللي هي for severe cases. لللابراتوري دايجنوز بنلقى انه we can use a rapid antigen detection test or RIDTS اللي هي this test or this rapid antigen test provide quickly result but have slow sensitivity. They are useful for the point care screening في peripheral clinic but negative result remain require confirmation. Any patient become negative by this technique, we need confirmation. A real-time PCR is a gold standard for the diagnosis and subtyping and capable for distinguishing from pandemic strain. Serological tests, different serological tests is used for the epidemiological surveillance rather than the acute diagnosis. عندنا الفيرال culture we can use a shelf vial culture with immunofluorescence is technique is faster than the conventional culture, but it still requires specialized laboratories. For that, it's very difficult to use for diagnosis. For that, viral culture is used only for the research, not for the diagnosis of the patient. Here we talk about other viruses, respiratory syncytial viruses. Respiratory syncytial virus. Respiratory syncytial virus is a major virus which causes a lower respiratory tract infection in the neonate, in the children less than 2 years. It is belong to the family called Pneumoviridae, genus Orthopneumoviridae. Genome, it is a single strand negative RNA, non-segmented, if that means is one segment involved in present. اللي هي measured glycoprotein which we found in the involved اللي هي F protein responsible for the fusion in the cells, and the G protein اللي هي needed for the viral attachment to the host cell. Generally, we found the respiratory syncytial virus is the leading cause of the bronchitis in the infant, to measure viral pneumonia caused by this virus in the children less than 2 years. A significant pathogen in the elder adult with severe disease can cause severe disease and immunocompromised. السيزونال outbreak نلقى دايما بيحصل له outbreak في الوينتر time الوينتر temperature in different region. طيب الاف بروتين اللي هو the most major variance factor and principal or the main target for the recent developed اللي هي RSV vaccine اللي هو عندنا monoclonal antibody different type of the vaccine الآن بيحصل لها شنو بيحصل لها development. الكلينيكال مانفستيشن والهيستوباثولوجيكال فيتشر والكلينيكال كورليشن بنلقى إنه respiratory virus syncytial is a leading cause is one of leading cause of bronchitis in the infant and major cause of the viral pneumonia in the children, which you say in the previous slide. It also significant. It is also can cause a pneumonia, wheeze, and opening in neonate, and the exploration of asthma and the chronic obstructive pulmonary disease. Histopathological, when we take a sample or biopsy from this patient, you can see fogging of the epithelial cell, airway edema, and mucus fogging. You also in the clinical coloration بنلقى إنه small lymphatic bronchioles are easily obstructed by the edema and mucus, and severe cases may progress to hypoxia and the respiratory failure, which lead into death of the neonate or die of the neonate. How we can diagnose of a respiratory syncytial virus? We can use a nasopharyngeal swab as a suitable sample with a nasopharyngeal aspirate, أو ممكن يستخدم nasopharyngeal aspirate or other type of the sample اللي هي bronchoalveolar in severe disease. We can emerging molecular diagnostic include a digital PCR point of care molecular assay. This is the most technique used for the point of care molecular assay. مصدم في معظم مستشفيات الريفرنس hospital of neonate. We can use also multiplex syndrome respiratory panels اللي هي diagnosed for many viruses which can cause a respiratory tract infection. Also, we can use a whole genome sequences for the molecular surveillance and to detect the genotypic difference. In this table, you can see different methods and a clinical application. Rapid antigen test used for rapid pediatric screening. أي مستشفى بتاع البيدياتريك بنخد فيها rapid antigen testing. Direct fluorescence antibody اللي هي moderate sensitive. When we need to confirm rapid antigen test, we can use a real-time PCR as the gold standard. A multiplex respiratory PCR we use to diagnose many different type of the virus which can cause a respiratory infection. A viral culture we limited for use. It's used for the research only or surveillance, not for the diagnosis. Here we talk about the other viruses, SARS-CoV-2. It is a common virus, all of you know about it. طيب SARS-CoV-2 is a virus responsible for the COVID-19. الديسيس اسمه COVID-19 والCovid-19 الديسيس بسبب لنا الفيروس اسمه what؟ اسمه SARS-CoV-2. belong to the family called the coronavirus and genus beta coronaviruses. It has a post-sensing single strand RNA genome of approximately تقريبا وزنه the weight is about 30 kilo base and is involved viruses. Structured protein have different structured protein include the spike membrane involved a nucleocapsid have a cellular receptor is the ACE2. In general, clinical manifestation of this virus ranges from asymptomatic infection to mild upper respiratory tract viral pneumonia اللي هي acute respiratory discharge syndrome اللي هي multi-system inflammatory syndrome and long COVID infection. The treatment which used for these viruses is target spike protein والRNA dependent RNA polymerase target by the different type of the antiviral is example remdesivir والmain protease target by malrevil والهوست بروتيز اللي هي الهوست بروتيز also target by TMRSS2 drugs. Here it is the life cycles of the SARS coronaviruses. هي after spike protein بيحصل binding ال ACET receptor الفيروس enter a cell the RNA after that release and immediately translated to viral protein. The virus make many copies of genomes and assembly of new virus particles inside the cell and release them by the exocytosis. حاليا ال different drugs which used for the treated patient it is a target viral enzyme اللي هي تصطي هذا ال RNA polymerase والmain proteases enzyme. How we can diagnose the SARS-CoV-19 اللي هي the diagnosis of COVID-19 begin with the patient with the symptoms collection of samples اللي هي المين sample بتاعت another swab and we use a real-time PCR for testing. Positive test or positive result confirm this infection while in negative results with a high suspicion may be require repeated or multiplex PCR. لذلك كان patient مذكرين في الكوفيد 19 لما كان patient عنده symptoms وكان نيجاتيف بنعمل له ريبيت تاني للبي سي ار. الكي تيست include real time PCR as the gold standard rapid antigen test for the screening of all contact patient, multiplex PCR for detecting the co-infection with serology for the past infection or the vaccine response. والwhole genome sequences استخدم or used for the sequencing for the virulent surveillance. The integration of all these tests has to be essentially for managing the pandemic and tracking the viral evolution. All countries integrated all these tests when we diagnose the viral or we need to screening the gene of the viruses which cause infection in the different country. Here we talk about the other virus اللي هي human coronavirus اللي هي seasonal human coronavirus. This is rather than the coronavirus which causes the COVID-19. Then a seasonal human coronavirus we have a different type. This is viruses belong to the family coronavirus subfamily orthocoronavirinae الجينس الألفا والبيتا كورونافيروس والجينوم بتاعها هي عبارة عن positive sense single strand RNA positive sense اللي involved present with a characteristic عنده spike مهم جدا جدا اللي هو الجلايكوبروتين. We have many type of the virus belong to this genus اللي هي عندنا الكوف الهيومن كورونا فيروس اللي هي 229 والهيومن كورونا فيروس اللي هي ال NL63 والهيومن كورونا فيروس ال OC43 والهيومن كورونا فيروس اللي هي ال HKU1. All of them belong to the different family. You can see E wal NL belong to the alpha, and the OC wal HK belong to the beta. We see that الألفا اللي هي ال 9E it is a cause a common cold and upper respiratory infection, while ال NL63 اللي هي cause a common cold و crop in children. مهم جدا إنها بيعمل لنا شنو crop in children. اللي هي ال OC43 cause the upper respiratory tract infection and the bronchitis، وال HKU1 اللي هي cause pneumonia and the upper respiratory infection. طيب all of these seasonal coronaviruses circulated in different parts of the world, especially during the winter. كل السيروتايبس of the corona دي اللي هي بيحصل لها circulating موجودة في كل العالم، وخاصة وين in the winter season. People can become infected many times throughout the life because immunity is decreased over the time. All people can be infected many times لأنه immune system بيحصل لها decrease over the time of infection. Patients usually develop mild symptoms such as runny nose, sore throat, cough, and fever, while a severe disease mainly occur in the high risk groups اللي هم اللي عندهم defect في immune system like elder and the immunocompromised patient. يبقى seasonal coronaviruses اللي هي worldwide distribution is responsible for the 15 to 30% of a common cold cases around the world. اللي هي big incidence of infection during the winter and early spring. بنلقى reinfection may be occur many times due to the decrease in the immunity, spread mainly by droplets والaerosol والcontaminated surface like the other respiratory viruses. We can cause different clinical manifestation here: rhinorrhea, nasal congestion, and the sore throat, and the cough, and the fever, and bronchitis. والنيومونيا in elder ممكن تعمل لنا نيومونيا وين في الريسك جروب اللي هي elder والimmunocompromised patient. How we diagnose seasonal coronaviruses? Seasonal coronaviruses because the systems of all this is overlapping or overlap. We cannot identify the virus by the symptoms, although we need to diagnose in the lab. The best diagnostic method is a multiplex real-time PCR, which can detect a third respiratory virus in the single test. Real-time PCR also can detect the specific coronavirus strain. Most patients need supportive treatment. معظم patients محتاجين ل supportive treatment because there are currently no specific because there are till now there are no specific antiviral drugs recommended for the seasonal coronavirus. يبقى الكلينيكال importance مهم عندنا ان نعمل differentiate للفيروس عامل لنا الانفكشن هو منو نحدده. clinical presentation اللي هي mimics الاوفرلابنج بتاعها كيف الكلينيكال symptoms انها هي mimic الانفلونزا والرينو والكوفيد 19. all of them are overlap in the systems. اللي هي molecular diagnostic technique is the most important technique for the diagnose and differentiate it. We use supportive care for the treatment اللي هي non-specific antiviral therapy. Here you can see multiplex PCR is a gold standard. Real time we can use for specific human virus strains. Multiplex syndrome panels we use for diagnose the different respiratory viruses. Also viral culture and serology, it is not used for diagnosis of the patient. اللي هي السيرولوجي بنستخدمه دايما في الابيديميولوجي والكالتشرينج for the research. another virus اللي هي الهيومن rhinovirus. في الهيومن rhinoviruses in the human rhinovirus belong to the family called the Bicronoviridae. الجينus enteroviruses. A genome is a positive sense single strand RNA have no involved. That means this virus is resistant to an environment. General characteristic of this virus اللي هي have more than 160 genotypes. That means it's very difficult to develop a vaccine. Most common cause of the common cold اللي هي acid labile replicated pest بنلقاه دايما replicated in the low temperature in the human body 33 to 35 centigrade. The clinical manifestation of this virus, it can cause the common cold, the rhinitis, sinusitis, adultitis media, asthma, salpitation, and the COPD اللي هي chronic obstructive pulmonary disease. في laboratory diagnose we can usually diagnose clinically, but we can use a multiplex PCR for the hospitalized patient or a high risk patient. Viral culture is rarely to do or to be performed. The current vaccine for this virus is very difficult because the virus have many different serotypes which become different to develop vaccine for each serotype. The other virus we talk about it is adenovirus. Adenovirus also one of the respiratory virus which cause infection. Adenovirus is different from the most respiratory virus. Why? Because it is a DNA virus and does not have involved. It can cause many diseases including pancreatitis, pneumonia, conjunctivitis, and gastroenteritis, and the hemorrhagic cystitis. Since it infected the cervical system body, adenovirus should be considered in the patient with a multiple clinical syndrome. Once a patient عنده multiple syndrome, we can put it in the hand, in the head, adenovirus. PCR is one of the most laboratory tests suitable for diagnosis of this patient because it is a it is rapid and highly sensitive. Multiplex PCR also panels we can use for detecting adenoviruses. So unlike other virus, adenovirus can be grown in the different type of the cell culture. The patient which is infected by this virus, we can find in the biopsy from this patient or tissue from this patient inclusion body called pedophilic intranuclear inclusion body, which is the marker for diagnosis of this patient in the histopathological lab. The clinical a special feature of this virus, which is have no involved for that, is resistant to many types of the disinfection. Also, adenovirus is able to establish latent infection. That means it will lead to the long infection. Adenovirus is an important virus to cause an outbreak in military recruit. In this slide show microscopic appearance of the adenovirus infection. The first image in the left, we can demonstrate the intranuclear inclusion body, which is a characteristic finding in the infected cell. In the second image, you can show electronic micrograph showing the virus particle of adenovirus under electronic microscope. The other virus is called which is called the respiratory infection اللي هي human parainfluenza virus. The human parainfluenza virus, this virus belongs to family called the Paramyxoviridae, genus Rhizoviruviridea or orthotropoviruses. الجينوم اللي هي non segmented negative sense single strand RNA involved in version. There are four major types of the human parainfluenza virus. The human parainfluenza type 1, 2, 3, 4. 1 it is called the crop, and 2 it is called also crop, and the 3 it is called bronchitis and the pneumonia, and the 4 serotypes with the most common serotype cause mild respiratory illness. اللي هي knowing of this difference help the clinical predict the which type of the viruses of parainfluenza can cause infections. The parainfluenza virus can cause a different type of the clinical manifestation, can cause the crop, or can cause the bronchitis, or can the pneumonia, or upper respiratory infection. General laboratory diagnosis we can use a real-time PCR or a multiplex PCR. Immunofluorescence culture is very rare. الكريتيكال important بنلقى إنه one of the most of the virus leading cause of the hospitalization in the young children where reinfection is come because the immunity is incomplete. بنلقى إنه reinfection of young children is common in the children because the immunity is incomplete. The other virus which you can call the respiratory infection اللي هي الهيومن ميتا الهيومن ميتا نيمو فيروسز. طيب في الهيومن ميتا نيمو فيروسز اللي this virus belong to the family نيموفيريدية جينس الميتا نيموفيريدية اللي هي جينوم عبارة عن negative sense single strand RNA اللي involved with present epidemiological بنلقى إنه this virus is found around worldwide high incidence in the winter and the spring. It is causal outbreak. Most children are infected by the age of 5 years of age. A reinfection may be occur throughout the life for a long time. The clinical manifestation, this virus it can cause bronchitis, pneumonia, and COPD. A general laboratory diagnosis, we can use a multiplex real-time whole sequencing for research and surveillance. We can use a different DNA. The other viruses اللي هي enteroviruses of the respiratory tract. These viruses belong to the family. It's called the Bicronoviridae genus enteroviruses, genome positive sense single strand RNA. Involved non-involved virus. We have the most type of which we can call the respiratory infection here enterovirus D68 اللي هي الكوكسيكا جيكوفيروسيس والإيكوفيروسيس and selected non-boilo-enteroviruses اللي هي virus are well known of causing الهاند والفوت والماوث disease and meningitis in different patients. This virus معروف إنه بيعمل لنا الفوت والهاند والماوث disease immunitis in different, but some strain, the most important strain which we call the upper respiratory اللي هي اللي قلناها which clinical significance of this virus, it cause upper respiratory tract infection with symptoms like a fever, rhinorrhea, and sore throat and the cough. Enterovirus D68 the important type of lower respiratory infection, particularly or especially in what in children. Also, this viruses, enteroviruses, associated with the bronchitis and pneumonia, asthma, illness, and rarely can cause acute vasculitis mellitus due to the neuro invasion لأنه ممكن يصير لنا وين النيرو cells ويعمل لنا infection. General transmission of this virus is through respiratory droplet and for many types by the fecal oral route. Real-time PCR is a gold standard for the diagnosis. For the diagnosis, we can use a multiplex real-time. We can use a multiplex PCR panels to target the different viruses to diagnose. The VB1 gene اللي هو used for sequencing is required for the typing of to confirm of enterovirus D68. While viral culture is rare for use for the research like the other respiratory virus. بنلقى إنه outbreak of this virus occur in late summer and autumn season. In this table, summarizes the major respiratory virus discussed in this lecture. The most viruses are RNA viruses, while adenovirus are the only DNA virus. The most are involved viruses except rhino and the adeno is non-involved viruses. Although these viruses are produce similar symptoms with their genome structure and laboratory diagnosis, but the genome structure and the laboratory diagnosis are different. Most respiratory viruses we use PCR is the gold standard because it provides high sensitivity and specificity for the diagnosis. Remember إنه نذكر دائما يا جماعة إنه symptoms alone cannot be used for the identify virus. And laboratory testing is essentially for the accurate diagnosis, operative patient management, and infection control. The first step in the laboratory diagnosis is collecting the correct specimen or sample. For the upper respiratory infection or the old virus, the best sample it is another pharyngeal swab. If difficult, we can use the other type of sample, oropharyngeal swab, or a multi-turbinated nasal swab, or a nasal aspirate, or nasal wash. It's for use for the upper respiratory. أما في اللور respiratory, we can collect a sample like sputum, an endotracheal aspirate, or bronchoveral lavage, or a lung biopsy. في الclinical syndrome, in different clinical syndrome, we can use a different type of sample. في common cold, we can use a needle, another pharyngeal swab. في influenza, can use another pharyngeal swab. For respiratory essential virus, we can use another pharyngeal swab. For a pneumonia, we can use a sputum or a bronchoveral lavage, or for severe acute COVID, we can use salpal samples only. Choosing the correct specimen, it is greatly improves the chance of detecting of the different virus. For that, is a technique for the collecting samples. Best practical here: collect the sample within the first 3 to 5 days of illness. Use a fiber swab with a plastic shift to easy to moving inside. Avoid immediately place a swab into viral transport media. Avoid to use a swab with a calcium granulated or a wooden shift swab, because it can interfere with the PCR running. maintain الكولد chain. لازم الترانسبورت يكون في cold chain اللي هي 2 to 8 centigrade. promote or freeze, ممكن نعمل لها freezing -70 if delayed to diagnose. A common cause of the false negative result, it is may be due to the poor sample technique, delayed sample collection, inadequate transported condition, or a low viral load, or inhibitor in the PCR, or improper storage of the sample which you collected. All these source can be lead to false negative result observation. For that, the medical laboratory scientists have an important role throughout the diagnostic process. زي كلكم انتم medical laboratory scientists مهمين جدا في diagnostic process. First, مطلوب مننا كلنا في البداية نعمل check whether the specimen is suitable for the testing. Next, track the viral nucleic acid, perform molecular testing, monitoring quality control, and interpret amplification curves اللي هي CT waves. Finally, validate it. لازم نعمل validate the result and communicate it urgent positive finding to clinician. Accurate laboratory result depend on the careful work at every step, not only on the PCR machine. يعني تبدأ معنا من collection للsample at the last when we write a result. Here is the mapping, show the diagnostic flow of the different lab beyond running for different assay. Medical laboratories oversee أي medical laboratory scientist مطلوب منه يعمل oversee the sample acceptance and the nucleic extraction, assay performance, quality assurance, interpretation, reporting. Each steps contributed to reliability of the final laboratory result. بتأدي لنا في النهاية لنتيجة مقبولة or not. Serology and the viral culture for the respiratory sample. Serology generally is used for the epidemiological study and evaluating a vaccine response, but is not recommended for the diagnosing an early acute infection. Why? Because the antibody require a time to develop. We can use serological, we can detect specific antibody, IgG والIgM neutralizing antibody. دايما بنستخدمها retrospective diagnosis, prevalence study, vaccine response, and epidemiological surveillance. The viral culture is isolated viable infectious virus is not suitable for the diagnosis. Is used for the vaccine development, to test cell viral antiviral susceptibility testing, or a viral structure or characterize it, and research and use for the different laboratory. It not used because it's limited to slow round time and highly biosafety requirement. It is for that is not used for the diagnosis of the patient. The molecular method are now is the foundation of the respiratory virus diagnosis. Molecular technique here and a foundation that diagnose what different respiratory virus viruses. Real-time PCR remains the gold standard because it rapid, highly sensitive, highly specific multiplex PCR panel detects several respiratory virus in the one test, saving both time and sample volume. Rapid antigen tests provide quickly result but are less sensitive than a molecular method. interpreting the result بتاعت البي سي ار. always consider the patient symptoms. دايما ناخد في بالنا البيشنت symptoms, sample quality and the CTV value and the quality control result. All of these, if it had all of these elements, it is determine what is the result is accurate or not accurate. And next generation sequence and integrated diagnostic. Next generation sequences provide the whole genome sequence for the different viruses. It supports this whole genome sequence is a support a variant identification to identify different serotype and type, molecular epidemiology of different viruses, outbreak investigation used for the antiviral resistant detection and discover of emerging virus. In routine practice, diagnosis usually begin with a real-time PCR, not by next sequencing using a server diagnostic method. طيب الانتجريت of laboratory diagnosis using of server diagnostic method together gives the most complete understanding of the respiratory viral infection. Here we can use a PCR, here the gold standard. Rapid antigen fast point for the care screening serology, previous infection and the immunostatus of the patient, viable virus isolation for the different study. Next generation sequencing اللي هي genome surveillance and precision public health problem. In the last we discussed the treatment and prevention of respiratory viral. Early diagnose all patients to receive a treatment at the right time. يبقى الدياجنوز بتاعنا هو مهم جدا عشان نعطي البيشنت right treatment at the right time. For the influenza antiviral drug which you can use different type of drug اللي هي الأوستومايفيرا والزانامايفيرا والبرامافيرا والكوفيد 19 we can use a different type ريمدزيفير والريتونوفيرا. الريسبيراتوري essential virus we can use the ribavirin والنيدروفيبام. Antibiotics should not use for the routine treatment unless the bacterial co-infection is confirmed. And vaccination remains the most effective way to prevent a severe respiratory viral disease. Vaccine effectiveness it is found by the viral mutation and the host immunity and age of vaccination coverage, the area and the time since vaccination. الوقت احنا خدنا فيه الفاكسين. Laboratory diagnosis it is important to support the treatment decision, to support the infection control and to support the vaccination strategy. That means combining the early diagnosis with target antiviral therapy while vaccination or public health measure provided the most effective approach to controlling a respiratory viral infection. In this picture you can see a different prevention and control respiratory viral procedure. We can use a vaccination اللي هي like influenza vaccine every year, COVID-19 vaccine, RS vaccination for older adults or maternal when recommended, and the high vaccination coverage is the reduced cerebral disease والhospitalization. Also personal protective measures مهم جدا, washing الهاند, الماسك and they stay at home when to reduce the transmission. Health care invention, prevention and control is a very important standard and transmission based precaution, droplet contact and the airborne precaution when indicate the early identification, isolation, also adequate ventilation and environmental cleaning and disinfection with safe specimen collection and handling under biosafety level 2 and biosafety level 3. laboratory public health measure اللي هي rapid molecular technique used for diagnose outbreak investigation, contact tracing, and implementation of control measurement. Before we finish of this lecture, let's review the main points we discussed above. Here, respiratory viruses are the major cause of the illness worldwide. Different viruses produce similar clinical symptoms. For that, laboratory diagnosis is essentially real-time PCR remain the diagnostic gold standard for the most respiratory virus. Correct samples collection is critical for the accurate diagnosis and vaccination while infection control measure. While early antiviral treatment is the most effective way to reduce the disease and the disease severity and prevent the transmission. I think this lecture bring us to the end today. Remember إنه أهم مسج إن إحنا لو طلعنا بيها understand the classification بتاعت respiratory virus و recognize the clinical presentation of the patient والlaboratory diagnostic method والbiosafety والinfection prevention ده المهمين جدا to control infections أو transmission of the respiratory tract. Thank you for attention. That is all.